Tots and Teens in Focus. Welcome to another edition of Tots and Teens, Doing Well in the Neighborhood. Today we have a special guest, and it's about the community. And you know Tots and Teens love the community. And we like to work along with NGOs and organizations within the community. Today we have no other than a representative, Ms. Carline Farrier from MetroPlus. Yes, she will be telling you about Obamacare, all of affordable care, and why you should have your insurance and why you should try to register and get your insurance before the year is out. And to no other person that you could make contact with is MetroPlus, and she will be telling you how you can have your affordable care with your salaries and your work scale. So join us as we talk about Obamacare, affordable care, and Metro. Welcome to Tots and Teens in Focus, and I know that the community will be enjoying this particular session, this particular edition, to know more about Obamacare, because a lot of people don't know, even I don't know. So I'll be learning from you today. Welcome once again to Tots and Teens in Focus.
Thank you for having me, Ms. Strim. I consider it really a blessing and honor to be speaking with the community about this important topic of health insurance. Again, my name is Carline Farrier, and I work for MetroPlus Health Plan, as the title is Marketplace Facilitated Enroller. The Facilitated Enrollers, otherwise called FEs, have been trained by the state to assist individuals and families to enroll in health plans that best suits their needs. Everyone calls it the Obamacare. It's really the Affordable Care Act that was implemented in 2013. And so we are in the community, and we're trying to get the word out that November 15 again is the beginning of open enrollment. I'm sure that a lot of people might have remembered March 31st being deadline. That was the deadline to enroll for 2014. Now, for those who never enroll for the entire year, there will be that fine when the taxes are filed, which is for individuals $95 or 1% of the gross income. Now, some people can make that wrong right for 2015 by coming into our facilities, so that we can, as well as there are other facilities that the state provides, to assist you in doing your enrollment for 2015.
So what are the places that they will have to go to get the help that they need? I know MetroPlus, and some people might not hear about MetroPlus because they heard about different other health insurance. So tell us more about MetroPlus, and where it's from, why it's from, and what it's the work it's doing in the community.
Sure. MetroPlus Health Plan is actually 18 years old. It is owned and operated by HHC, that's Health and Hospital Corporation. And so we are primarily, a lot of people know us from being in the city hospitals. For example, in Brooklyn, we are in Woodall Hospital, Coney Island Hospital, as well as Kings County Hospital. But we are also within the community. I'm sure a lot of people have seen our trucks, the RVs. We try to be in a community where a lot of people are, in order to service them. We also have a location at the Kings Plaza Mall. We actually have a kiosk set up to, again, assist individuals and families. And in the very near future, we will be opening an office located on Church Avenue between Bedford and Flatbush.
Okay. So as we're learning more about Metro PC, what are the benefits that you will get from Metro PC?
Well, the benefits that you get from becoming a member of MetroPlus Health Plan, as with the others, it depends on what you qualify for. So under the Affordable Care Act, Obamacare, you can qualify based on your income, family size, tax status, as well as tax deductions for a number of programs. This includes Child Health Plus for children under the age of 19, regular Medicaid managed care, and the qualified health plans. Each plan has different benefits. So, for example, if a child qualifies for Child Health Plus, there are no co-payments and there are no premiums. However, if it is Medicaid managed care, the co-payments are somewhere between $1 to $3. It covers, its full coverage is dental, vision, and medical. Of course, the cleaning of the teeth or laser eye surgery might not be covered because that would be considered cosmetic. And that's just, in a nutshell, that's what it is. For the qualified health plans, I'm sure a lot of people might be like, what are they talking about? The silver level, the bronze, the gold, the platinum. Those are just different plans based on your family size and how often you go to the doctor, because there will be deductibles, there will be co-payments. That's where you decide what plan best suits you.
So how would you know what plan best suits you? If someone is working for below the minimum wage, how can you know what plan will suit you? If they are not working,
right?
I want you to talk about that. If they are not working, why do they have to pay co-payment and they're not working?
Well, if someone is not working, because in terms of Medicaid managed care, some of the people that qualify are actually people that are working. Your income has to be below up to 138% of the federal poverty level, whatever that is for your family size. And the co-payment might be a $1, $2, or $3. I might say that they say that there are some pharmacies that might not charge that co-payment. There are some doctors that might not charge it. But when we are enrolling anyone, and if they qualify for that program, we have to inform them that that is so. The co-payment really, when it comes to the silver, bronze, gold, or platinum, this again is based on your income. Okay, let's say, for example, someone is working but their income is above that which to qualify for Medicaid. They might say, for example, just let's say a plan costs $300, just to give a rough figure. Some people do not pay that full amount because there's what's called cost sharing reduction, and there's what's called the advanced premium tax credit. Those are the technical terms for the assistance that the state and the government gives you to pay your premium based on where you fall on the federal poverty level. That is why it's a one-on-one process with you and the enroller that's assisting you. Once we have put all the information into the system under the New York State of Health, that's where the determination comes up. We don't make that determination. The New York State of Health does.
So MetroPlus comes under the government funding for medical.
The programs that we manage are under the Affordable Care Act. Yes.
So do any persons, even if you're working, you still have to pay, that medical benefits comes out of your salary?
Well, that's the other thing that we need to clear up. You need to have health insurance, and that's what the law under the Affordable Care Act says. So if your employer already provides you with health insurance, then you don't need to find an enroller to assist you. You're fortunate enough where your job offers health insurance for you and your family. But there are cases where the job might not offer health insurance, or might not offer it for the spouse or for the children or for non-custodial children. That's where we come in play. So it is to ensure that all Americans have health insurance. And that's the law.
And that's the law that President Obama try to get and make people understand, because some people told me that the Obamacare, they're losing more than they're gaining, such like doctors will not be able to get the amount of money that they're supposed to get. How would you see it? Explain that.
Well, when it comes to that, I really cannot answer that portion of the question. Who is losing, who is winning. However, I must again stress that regardless of the fact that it may be looked at in the future, regardless of what the repercussions are right now, it is a law that was signed in 2010. So whether or not people enroll, when you have to fill that income tax return or someone is claiming you, that question will have to be answered. Do you have health insurance? So it behoves, especially individuals that know that they may qualify for the free insurance, and we are walking around with our health insurance, to sign up for health insurance. You know, I had to do a study recently for a paper, and I had to look at the cost of health insurance in the emergency room. And would you believe that 2 Tylenol that cost you about 75 cents at the corner store, when you get billed at the emergency room, if you had pain, that would be $40 on your bill. So it behoves you to have health insurance. And I'm not here to preach one company over the other, because I'm forbidden to do so. But what I'm here to say is, let us make sure that when we turn up at the emergency room, we have something in our pocket, in our pocketbooks, to say, here, I have health insurance, here's my card.
No, it's because I spent 10 days in the hospital, and my bill come to over $100,000 for 10 days, and they billed me for the nurse that brought the tablet into me, the cotton wool that I use, everything that they bill you for, you know. And I wonder why, you know, but that's another story. So, what happened?
They're trying to tell me, give you a 2-minute, it's going to take a 2-minute break.
Okay. We talk so much about the medical plans in MetroPlus and the work that it's doing and helping our people. But you know, we have 18 million undocumented residents. How do they fit into the medical plan? They're here already. How do they fit into the medical plan?
Yeah, well, it's interesting that you asked that question, because as a matter of fact, children under the age of 19, remember I mentioned earlier that program called Child Health Plus? That program is for children who do not qualify for Medicaid, or whose income, because of that, the family's income is above, and so they have to pay monthly. That program also covers undocumented children. You see, it was back in...
No child left behind.
When people had, you know, a number of people got on their vehicles and they went up to Albany and they petitioned to Governor Pataki at that time. That's how Child Health Plus came into being. Because the emergency room was being overrun because people had no health insurance to go to the doctor. So for little things like the cold, you know, parents were taking the children to the emergency room, and that's how that program came in effect. So a child under the age of 19 can get Child Health Plus. In addition, there are people that they're called PUCAL. It means presiding under the color of law. That means that this person is here in this country. USCIS know that they're here. They're not asking them to leave. Meaning, my documentations are pending. For example, I did not yet receive that employer authorization, that's a work permit. The person may not have received the green card as yet, but they're pending. Those people can, under certain categories, and again, it's a one-on-one basis, you know, you'd have to go into an office and speak with an enroller. Quite a number of these individuals can enroll because they have the actual immigration status needed to qualify for one of these programs.
Well, so good. I hope that everyone is listening and could be able to make their own decision on which one of the companies or medical benefit that they would like to have. As for older people that are not working, I know a lot of old people that are not working, they're out of their job, but because they may have a property, they cannot get medical benefit. How can they able to acquire?
What age group are you talking about?
I'm talking about 70 and up.
Okay. If those individuals have Medicare, We do have a Medicare product that, based on certain criteria, we're able to look at and see if they qualify. However, because I'm not Medicare licensed, I wouldn't speak on that. However, if anyone needs information about Medicare program at MetroPlus, they could call 1-855-809-4073. Again, the number is 1-855-809-4073. There are programs for older individuals. Now, the individuals who, let's say, just came into the country, and because they didn't work in the country for 10 years, they do not qualify for the Medicare. They can actually go to the Medicaid offices, for example, the T building or 35 4th Avenue. And once going there, there are specialized navigators that will assist them.
Okay. Oh, so the Medicare and the process of Obamacare, how long would that take?
To do an application, it's interesting because I've done applications that take under 15 minutes. And then there are times, because of technical difficulties, it might take a little bit longer, maybe a half hour or so. There are times when an application will go all the way through because there are no questions on the income or the immigration status. So just let's say, for example, an individual was working, the income is gone, the person is no longer working. And they come to do an application. Because the system is linked to the federal system, when the social security number is checked, it would appear as if that person is still working. So sometimes the system might say, well, the income doesn't match, we need proof of your income. And then that's where you will put that proof of that person is no longer working. You will have to upload it. It might take a few days. But normally, 15 minutes to half an hour, as long as the system is working technically well, an individual or family can know what they qualify for and have their options of their health plans.
So MetroPlus issue what card? Medicaid card, Medicaid and Medicare and Medicaid or something like that?
No, that benefit card, that blue and white card that a lot of people call it the Medicaid card, actually comes from the state.
Oh, okay.
That once you qualify, it goes through. You have made a selection that will be mailed to you by the state. If you have selected MetroPlus health plan, then once you are active, your card, your MetroPlus card, will be mailed out to you. If you have selected another health plan, the card from your health plan is actually mailed out to you from that health plan.
So the benefit plan is with the government benefit?
Well, yes. In terms of the Affordable Care Act, it is the website is the New York State of Health.ny.gov. That is where you go to actually do the application. If you come and you sit with one of us, that's his website. We go on as a marketplace facilitators and enrollers to help you. However, let's say you want to try it on your own. You go to New York State of Health.ny.gov. The process takes, first of all, you have to get your username, set up your password. Sometimes you find that doing that, you have to access your email. So it's a little bit technical, but not that difficult.
Not that difficult.
No.
You heard? Get your Medicaid from MetroPlus. Tell us a little bit more about MetroPlus. Is it have any outlining areas like, or is just in New York they are located?
Well, we actually are in the 4 boroughs. In order to be a member of MetroPlus Health Plan, you have to live in the 4 boroughs. So that's Brooklyn, Bronx, Queens, and Manhattan. So that does not mean that if you don't live within those boroughs, we cannot help you. When we help you, the system will show you the health plans that you have a choice of. So we're here to help the community. And MetroPlus Health Plan has been in the community for 18 years. And it's a health plan that intends to stay. And I'm sure when you see during the summer holidays, the churches have their health fairs. We're there. You know, the fun days, the unity walks, we're there. And I'm sure next summer, Tots and Teens and Focus, you know, we shall be there.
Yes, we always have a health fair every year, but I never get MetroPlus. I always get other things, but I know this year y'all will be there. Yeah, so as a community person, and you talk about MetroPlus, how can we able to get to the, do you go to churches to explain to people who may not quite understand what is going on?
Yes, actually, we go to groups. We'll go to community groups if we're invited to do a presentation, answer questions. We will go to church groups. We go to other religious organizations. We go to the schools. We will go to the daycare centers and we'll speak with the parents, you know, and we go to the middle schools and the junior highs that are and the high schools that are assigned to us open school night, just to get the word out. During the summer months, we're outside, and we're outside because we're here to educate the community one-on-one in a group presentation. If you call us again, 1-855-809-4073, the Community Relations Department will send someone out.
Okay, we'll be right back with more from MetroPlus. Now we're going to talk more about Medicaid and Medicare, the difference between it, because, you know, sometimes it confuses the issue of Medicaid and Medicare that, you know, not all of us know the difference. And she will explain to us the difference. She said some of them she cannot talk because she's not a registered person for that, but she will give us what she can tell us about the Medicaid and the Medicare.
Well, as an overview, because to do a presentation on Medicare, you have to be licensed to do so. But what I can say is Medicare falls into that which individuals over the age of 65 generally, or some disabled might get. They get that red, white, and blue card. That has nothing to do with the plans that I do the enrollments for. And that's all I'll say on that. MetroPlus actually do have a plan. And as I said, anyone that has questions on that can call the 1-800 number and someone will answer that question. However, Medicaid is one of the plans under the Affordable Care Act, aka Obamacare. Again,
so what is AKA?
Otherwise known as.
Okay.
And
so it's not a medication, it's AKA.
And of course, you have to fall within 138% of the federal poverty level. For example, just as an example, in New York State, I believe as a single person, no children, if you make $16,105, somewhere thereabout, or less, you may qualify for Medicaid. Anything over that, for a single person, they're looking to purchase a qualified health plan. But then again, it's a one-on-one basis. We sit down with you, we put in the information, and the system generates what you qualify for.
Well, you have heard it all from MetroPlus, and you know, this information is good for the community. I'm so happy to be a part of MetroPlus and to bring this information out to you because, you know, I am learning too, and I'm sure that you at home is learning too because you would like to get some information. Before we go, she will encourage you why you should go out and get your Obamacare. It's very important. Time is running out, and I know that you need it. Do not waste no time about it. Important to get your Medicare. It wasn't an easy job for him to get it, but we're going to go out there and get it. And I asked Miss Farrier to give you the more encouragement to before we leave about Medicare, the Obamacare.
And thank you again for having me. I just want to stress to the community how important it is to have health insurance, period. So if you do not have health insurance and you have questions, please find an enroller, find the location. We will answer your questions. We will assist you where necessary to do your applications. But ensure that come the end of 2015, you're not paying a fine because you did not sign up for health insurance. Thank you again, Ms. Trim, for having me.
Thank you, Carline Farrier, for being on Tots and Teens to talk about Metro PC. Metro Plus. Here I go with Metro PC. Metro Plus. Metro Plus is the Medicare medical institution and medical
Health plan.
health plan, the medical health plan that is good for you. And so go out there and get it done. If you don't know about it, she gave you the number that you can call. Make certain that you stop at the hospital. They are there. Make certain you go to King's Plaza. They are there. Or anyone in the hospital's health fair. Make certain you get them because they are at health fair every weekend. And they will able to give you advice on getting your medical papers or your medical whatever medical Medicare that you ought to get is very important. You cannot live without your medical attention and you have to pay the bill. So go forward, check it out, call them up, get more information so you can be medical free and you have nothing to worry about because all your medical plans will be paid for through the agent of Metro PC once you become a member of Metro. Thank you once again, Ms. Farrier. Thank you for being with us and giving us such information.
My pleasure.
I have learned a lot. I'm now educated and I can talk about Metro Plus and tell you where you should go and get your thing and why it's important and to know more about the Obamacare and the Obamacare plan that is here for you. Thank you, viewers, for watching us. This is Tots and Teens in Focus, and this is your host, Patricia Trim, saying goodbye from Tots and Teens, and we will see you next time very soon. Keep tuning.